New research shows people 50 and older who have had a mild case of COVID-19 are 15% more likely to develop shingles, a viral infection that causes a painful rash. Dr. Kumar with Austin Gastroenterology joins us this morning to talk more about this. Good morning, Dr. Kumar.
Good morning, Casey. Good to see you.
You too. So first of all, just kind of talk about what shingles is for a second.
Yeah, so shingles is the chickenpox virus. You know, we all had chickenpox when we were young, particularly people over 50 certainly have. Vaccines for it when you're younger, but people that are 50 and 60 and older have had chickenpox. And the chickenpox never truly went away in most of us. It kind of lay dormant in a nerve root. And when we get older, above 50 and 60, this virus can reactivate. And when it reactivates along the nerve root. And so you get this really painful rash that comes in what they call a dermatome, in a patch somewhere on your body, and it can be extremely painful. And even after you treat it with medications, it is treatable. Some people can get post-herpetic neuralgia or pain in the nerves even after you get rid of it. So it's certainly something you want to avoid. And what's interesting about this article, published in Open Forum Infectious Disease, not one of the major journals, also sponsored by a pharmaceutical company, GlaxoSmithKline, but the data is evident. They compared about 400,000 patients that had COVID compared to 1.5 million similar patients that didn't get COVID. And they noticed that in the non-COVID infected group, that the risk of developing shingles in that study time frame was about 6 in 1,000 patient years. What that means is if you study one patient for 1,000 years, that's 1,000 patient years. If you study 1,000 patients for 1 year, that's 1,000 patient years. But it's a good way to compare apples to apples. And they looked at people that were over age 50, and their risk of developing shingles was about 8 in 1,000 patient years. So that difference was about 15%, as you've alluded to.
Yeah. What do you think the reason is for this? Why is COVID triggering shingles?
So the reason we reactivate shingles as we get older is because there's a suppression of the immune system, or even if you have chemotherapy or you're under some immunosuppressive drugs, that can also reactivate shingles in older people. And that's why it's older people that are getting shingles and not a person in their 30s, because there's some immunocompromised state. And so what's believed is that COVID comes in and disrupts your immune system, and it's that disruption of the immune system that lingers that can lead to a provocation in shingles. What's interesting also is that the more severe your COVID is, the risk of getting shingles goes up. While it's 15% higher in people above age 50, that number jumps up to 21% if you've been hospitalized with COVID and you're over age 50. So there's a double whammy there. So the more severe the infection or the advanced your age, that getting COVID is an independent risk factor for getting shingles. And the take-home message, even before the pandemic, there's always been a recommendation that once you hit 50, you ought to consider getting vaccinated for shingles. There are vaccines out there. An older vaccine was about 70% effective. We have a newer vaccine, 2 shots, about 90% effective. And so if you're over 50, have had COVID, it's another reason to go consider getting that shingles vaccine.
There you go. Dr. Kumar, thank you so much. We appreciate you. If you have a question for Dr. Kumar, email us at askdrkumar@gmail.com, and you can check out his website, drkumar.com.